just had a meeting. We've got a lot of talent in South Carolina, and all of it is being assembled. We collaborate, communicate, and cooperate to be sure that anything that needs to be done, whether it's hurricanes or floods or anything else, we have the people, have the brain power to know what we're doing and to do it just right. As far as you all hear about the coronavirus, which is something new on the medical scene, which is one reason that it is attracting so much interest, because it's a new kind of virus. But I would say if I could quote the group, the Eagles, my advice is to take it easy. Don't get all excited. This is not a hurricane. It's not a flood. It's like the flu. This coronavirus, you could call it the first cousin to the regular flu, and probably everybody in here has had the flu or a cold. And what do you do when you have a flu or a cold? You go home and you call your doctor, and you go home. And so that's what, if you have the flu or you have a bad cold, call your doctor, go home, stay home till you get well. This particular virus, unlike the chicken pox, which is carried in the air, can float around, the other things, diseases that are airborne. This one is not airborne. That means that those of us in this room, as long as we're not getting sneezed on or coughed on or touching a surface where someone has sneezed or coughed and then rubbed their mouth or rubbed their eye or rubbed their nose, you're not going to get this virus. It is not airborne. It is transferred by contact. It is in droplets. When someone sneezes or coughs, if those droplets are not caught with a handkerchief or a hand, if they go on a surface or go on the person's hand, and then they touch your hand and you touch your face, your nose, your eyes, or your mouth, then if they have this virus, then you can get the virus. It's just that simple. So if you just do what your mama told you all those years ago, and that is, if you go sneeze or cough, cover your mouth. If someone is sneezing or coughing, stay away from them. Or wash your hands all day long. The main way to kill this virus, if it is present, is how? Not with some dramatic chemical, not with radiation, not with the atomic bomb, but with warm water and soap. There's something in soap that everybody here has used this morning, I presume, and warm water that will kill the membrane on this virus. It might be the easiest virus in the world to kill with just warm water and soap. So do what your mama said. Cover your nose, cover your mouth if you're sneezing or coughing. Be courteous to your neighbors. Don't sneeze on people or cough on people and scare them. But wash your hands. If you don't have hot water, warm water, and soap, then just use the sanitizer. Just like they do in the hospitals. You see them doing it all day long. You don't need a mask. Don't need a face mask. Why? Because this is not airborne. It is spread by contact. And we have how many cases in South Carolina? 0. How many in the U.S.? Very few. We've had 2 deaths in the United States since this whole thing started. So again, I say take it easy. Don't panic. You don't need to stock up on anything except maybe hand sanitizer. Have some of that, but everybody's got soap and water. And I assure you, as you saw the people that were here earlier, and many of them are still here standing with us, we have people that know how to do these things, what precautions need to be taken. Those are the ones that I'm telling you about. But again, if you think you've got a bad cough or the flu, then what do? You call the doctor, you go home, and you take it easy. So that's our message. And we will be continuing to meet and communicate to be sure that South Carolina is way ahead of everybody in getting the best information and disseminating that to all of those that can give it out to our people, all 5 million of us. With that, Dr. Toomey, please.
Thank you, Governor.
Yes, sir.
Now wash your hand.
I'm going to. Give me some of that sanitizer, please.
Good morning. My name is Rick Toomey. I'm the director of DHEC. And at DHEC, we are closely monitoring the emerging public health event, the coronavirus or COVID-19. Part of our mission is prevention, but the other part of our mission is education. And education, such as the meeting we had this morning, sharing information with each other, sharing information with each of you, is so important with regards to this virus, the COVID-19. With us today is Nick Davidson, our acting director of public health, and Dr. Traxler, one of our DHEC physicians. And I'm going to turn it over to Dr. Traxler to give an overview of where we stand. The important part that is really exciting for DHEC for us right now is the CDC authorized the DHEC lab as of Thursday evening that we can do testing here now. So we are authorized to do testing. So samples do not have to be sent from any hospital in the state to Atlanta. They can come to Columbia. Part of that next focus is to disseminate those testing capabilities to regional hospitals and to hospitals. But we made a wonderful breakthrough with the CDC getting the testing kit out to state labs, and we again have that capability here in the state. Dr. Traxler, and thank you. I'm going to take some.
I wanted that.
You wanted that? Who said that? The infectious disease.
Good morning. Thank you, Governor, and thank you, Director Toomey. We at DHEC are very closely monitoring this rapidly evolving situation that is rapidly evolving both worldwide and the United States. However, I want to reiterate what Governor McMaster said. There are no cases confirmed in South Carolina at this time. DHEC will notify the public if there were to be a confirmed case. I want to also reiterate what the Governor said about the methods of prevention for this. Again, most importantly is that hand washing. Soap and warm water frequently for at least 20 seconds. It's roughly as long as it takes to sing the alphabet song. And use the hand sanitizer if you don't have soap and water, as we just saw a great example of. Another cleaning method we want to use is disinfecting surfaces, hard surfaces that are touched frequently. Do that very often with just your common, household disinfectant. Practice good respiratory etiquette. Cover your cough when you cough or sneeze. Throw away your tissues immediately after you use them. And then stay home when you're sick. Don't go to school, work, other crowded places, but stay home. Save the masks for the healthcare workers and folks who may need them at some point. And again, understand that at DHEC, this is what we do. We prepare on a daily basis for diseases such as this. We are monitoring the situation and remaining in close contact with the Centers for Disease Control and Prevention and following their guidance. If people think they are ill, we encourage them to call their physician. And then in regards to the testing, it is exciting that we have this ability now at our lab. However, people still need to meet the CDC criteria to be tested, and all testing does have to be authorized by DHEC, so specimens cannot just go directly to the lab. So with that, I will turn it back over to Governor McMaster. Thank you, sir.
Thank you, ma'am. Again, it's not airborne. If you're walking through the mall, you're not going to catch it unless somebody sneezes on you or coughs on you, because it goes in droplets, that is like raindrops, and they go down to surfaces. Or they can be on your hands if you sneeze or cough in your hand. So that's why we ask people, when you just wash your hands, warm water, do what you ought to be doing that. We all ought to be doing that several times a day anyway, because of other things that we can catch. But the symptoms are just like the flu, just like a bad cold. Again, no cases in South Carolina yet. We hope we don't get any. But if you don't want to be a case, wash your hands with warm water and soap several times a day. If someone is sneezing or coughing, get away. You don't want to get any of that on you. And if you feel sick, then do just like you do for a flu or bad cold. Go home, call your doctor. That's all you have to do, and we'll be just fine. Any questions by anybody? Yes, sir.
I have two for you. One, I was wondering if you could respond to what the president said a couple of days ago about the Democrats politicizing the government's response called the Democratic hoax. I know you were there. Why don't you have you respond to that, one? And then two, can you talk about how this might affect deployments overseas, military deployments?
Well, let's ask. General?
Right now, from the South Carolina National Guard's perspective, we're not tracking any information that changes any of the plans that we have for deployments. We are, though, going to be affected some by travel that was non-critical in terms of supporting the mission. We have seen some cancellation in that, but things that directly impact mobilizations, there's been no guidance yet driven that changes any of those requirements.
As far as your other question, that's one, I think the president answered that. I think that he was referring to being blamed on him was yet another hoax.
I know you tell
Yes,
people, don't panic, to take the precautions to kind of prevent the spread or even a case here. But we're getting the questions, the concerns from our viewers. First we thought it was something isolated to the Asian continent, and now we're seeing cases pop up without people who have traveled. What would you say to people who are worried that, hey, we're going to see a case here in South Carolina and be the next place?
Well, I think Dr. Traxler answered that. I would say this is something new. That's why there's so much interest, and it's always interesting when something new that we haven't seen before comes along. And also the fact that as yet we have not developed a vaccine. You can get a vaccine for most kinds of flu these days, but again, this is an easy thing to protect yourself against. All you have to do, because of the way that it is being spread, and it's by contact. It's by contact. It's not airborne, and that is you have to touch those droplets and somehow get those droplets in your eyes, your nose, or your mouth. And if you don't do that, then that is the way that this is spread. And if you don't do that, then you're not going to contact it. You're not going to have it. And it just feels and looks just like the regular flu, but of course it's something new. It's something different. So we just urge everybody to stay calm. Don't get excited. This is another new thing. But it's so easy to protect yourself, and we hope we don't have any cases in South Carolina. That's the main message. This is an easy virus to protect yourself against, just by staying away from people who are coughing and sneezing on you. Wash your hands, warm water and soap. If you get sick, you feel sick for any reason, do what you always do. Go home, get into bed, and call the doctor.
Yeah.
Yes, sir. Over there.
Oh, yes. So we heard you talk in the meeting about the economic impact of the Department of Commerce. So is this something that, with a lot of different companies dealing with China, Korea, do you think this is something that, will alter a lot of perceptions and, how business is done in South Carolina with those companies out there?
Well, that's a part of free enterprise. You never know when the logistics chain is going to be stopped or diverted, and so that's why, as we were speaking earlier, that all businesses always have plan A, plan B, and plan C to get the things that they need. And because a lot of these parts come from Asia, come from China, there are plans being made to address that. Yes, sir.
Director Bundy, possibly comment on that. I know we're from the upstate, so we have safety, the BMW is a concern. I know you mentioned something about a business in Anderson.
Yes.
Being able to do some replacement parts, kind of what we're seeing from the economic impact.
Sure. I think the governor alluded certainly to we obviously are working in a global supply chain, and some of that supply chain is from Asia, some of it's from Mexico, some of it's from Europe, and you have some great companies in the upstate. We have some great companies all over this state, and they're all working daily to maximize those supply chains. And when there's an interruption, and it might be COVID, it might be a hurricane, it might be anything, those companies are working ways to solve those interruptions as quickly as possible, and they will be resolved, and life will go on. So I think the comment I would make would be that resolution is always in process, and the governor alluded to the contingency plans, and believe me, they're in full force. So everyone's working on no shortages or minimization of those.
See, the good news in all this is our economy is so strong and manufacturing is so strong that we're worldwide. We get things from all over the world and send things all over the world. But there are always disruptions in these supply lines. That's why people are working on logistics. You could, if you talk to Jim Newsom down at the port, you'd be amazed at the kind of logistics that they deal with. A good example is that boat, the ship that turned over in Georgia. That was a disruption in the supply line for sure. That was a major disruption. But those are a part of the marketplace and part of the standard operating procedure for businesses. And what we're saying here, this is standard operating procedure for anything, just like a flu outbreak. In fact, in the United States so far this year, starting with the flu season, the regular flu season, about 16,000 people have died in the United States since September till now, and they've been tested about 260 or 280,000 cases. So that's just the regular common flu that we're so accustomed to. Well, this feels like the flu. That is the symptoms, what you'll feel, but it's different. So again, if you get the flu, you get a cold, do what you do when you always do. Do what Mama told you: is go home, go to bed, take it easy, and call your doctor.
Governor,
Yes, sir.
the governor of Florida said besides their 2 confirmed cases, they have been monitoring hundreds of others and have some negatives. Can you talk about, I know the state has no confirmed cases, has DHEC been monitoring anybody or had any negative test results?
Doctor?
All right. Hi, Nick Davidson, Acting Director of Public Health with DHEC. You're exactly right. We don't have any confirmed cases. We are routinely, as we do every day during the normal flu season, working with providers around the state to help them assess cases. And so we will test as necessary, but for the most part, we've been working with them to help them understand what are the actual symptoms and to help them diagnose those cases. And so we have not had any positives at this point in time. We'll certainly be in touch when we do, though.
I know you guys mentioned international travel in there, and that it's not a big thing here in South Carolina, but we've got international businesses, and there are certainly citizens from here who are abroad right now who will be coming back. Is there anything we're doing at the port? Are we screening or testing folks who are coming back from Europe or one of the areas where it's been a problem?
Well, the Port of Charleston doesn't deal with people, so it's goods. Sir?
The coastline, so when people are coming back in.
I can speak to the monitoring of international travelers. DHEC is following the guidance that is laid out by the CDC for monitoring of travelers returning from affected areas, and that is an ongoing process. And again, it has not resulted in any confirmed cases.
Does that mean you guys are screening anyone, or just in general? I'm sure you probably can't talk about specifics per se, but I mean, what does that entail?
So the CDC, I believe, has put that information on their travelers' website. Those folks are screened by the federal government when they enter the country. For health screenings, they're given information about the disease, the symptoms to watch for. They then get in touch with DHEC. We make contact with them when they arrive in the state, and then we ask them to stay home, to stay away from crowds for up to 14 days, and we assist them in monitoring themselves.
While you're up there, I know during the meeting here, there was kind of an outline, a timeline of, I guess, what DHEC has been doing leading up to this point and what the steps will be if there is a case reported. Can you kind of just briefly go over kind of the preparation that you guys have been doing and what that response would be?
Sure. So we have been doing a lot of outreach. As Dr. Toomey mentioned, part of our mission, in addition to preparedness, is that education of providers and other partners in the state. So we have been working with various entities, including businesses, other state agencies, schools, child care centers, colleges, and universities, and helping provide them guidance and resources through the CDC so that they can be prepared. We have had multiple meetings with various stakeholders. We have more of those meetings planned in the upcoming days. And as to if there were to be a case, again, we would let the public know as soon as there was a confirmed case.
Are you guys considering quarantines or travel restrictions?
That right there. Say it again.
Are you guys right now considering travel restrictions or quarantines at this point, limiting international business even?
As to actual quarantines or limiting travelers, that anything of that sort is being done by the federal government. In terms of business, I'll let Mr. Bundy or Governor McMaster answer that.
No, just simply just that the businesses are abiding all of their employees are abiding by the rules set forth by CDC.
He said that all of the international businesses are abiding by the rules that the CDC and Customs and Border Protection and the State Department have put forth.
Governor, do you expect any changes to your schedule? There's probably nobody in South Carolina who interfaces with people more on a daily basis than you do. So I'm just wondering, is this going to affect your travel schedule at all, or events, or anything like that?
No, sir. No, not a bit. I'm going everywhere. You name some place, if I haven't been there, I'll go as soon as but no, I always wash my hands and all that. Anyhow, I shake a lot of hands all day long, so I do what Mama told me to do, and that's keep clean, don't sneeze on anybody, and always carry a handkerchief with you.
Is there any timeline for a potential treatment, vaccine?
Who can answer that about a vaccine?
Certainly. So currently there is no vaccine or treatment for this virus. There are multiple vaccines worldwide in development. From what I understand, and this, again, the CDC and the FDA could speak more to this, but they are hoping to begin trials in the coming months of some of the first options for vaccines. Regarding treatments, there are clinical trials going on both globally and within the United States for treatment against this.
As far as our coastal areas like Charleston, is there a plan right now to test people as they get off of cruise ships, or some sort of contingency plan related to cruise ship travel?
Again, we are just following the CDC's guidance at this point, and there is no specific recommendation for screening of passengers who are just getting off of your regular everyday cruise ship.
Two more questions. Can you talk about the opportunity, maybe Governor, this one's for you, or Director Bundy, about maybe some of the businesses having to produce replacement parts for the affected parts of China?
Sure. So some of those businesses, quite frankly, have found some new suppliers here in South Carolina, and we're as a group of collaborative companies, we're always trying to work with each other in the supply chain. So some of that's going on as we speak, and some of that's coming from here in South Carolina. Certainly, the companies using those supplies are speaking daily with their counterparts in other parts of the world to discern where those levels are, and there's still everyone is operating actively today. No one shut down, and there are some inventories out there, and again, working with other companies on those solutions where there may be a longer time of disruption.
Can you just kind of go over the test kits? How many do we have, and what's kind of like the timeline when it comes to testing somebody and getting a answer of whether they have the disease or not?
Sure. We want to be able to provide information that's both timely, accurate, and actionable. So we do have the ability in the state to provide that testing. It's similar to the CDC. Our testing turnaround is 24 to 48 hours from the moment we receive the sample. Most times it's quicker than that, but certainly that would be the longest that it would take. We have the capacity to test up to approximately 100 a day at this point in time, and we are nowhere near that at this point. So our capacity is robust.
How many are you guys testing a day right now?
Sure. We definitely want to ensure the information that we put out is actionable by the public. As the governor said, this is not a time to panic. There's a lot of interest right now around this, and so there's bound to be a lot of requests that we have for testing. And so we're going to make sure to inform people of positive results that we have, because that's the information that's actionable from a public health standpoint.
Okay, well, as y'all can tell, we're like the Boy Scouts. We're prepared, and we believe in over-preparedness, and that's why we communicate, collaborate, and cooperate across the board to be sure that everything that there is to know and all the resources that are available are brought to bear on the situation. But again, this is a simple one. If you don't have a handkerchief, get one. If you're coughing and sneezing, cover your face. If someone else is coughing and sneezing, stay away from them. Wash your hands several times a day, warm water and soap, because that kills this virus. The soap will kill the virus right there. And if you don't have soap and water, get you some hand sanitizer. if you feel like you're coming down with a cold or the flu, go home, go to bed, and call the doctor. And if necessary, then we can go to the next stage with testing. But so far, that's, as you can tell, that's been of interest, but not a lot of activity in South Carolina. So we'll keep you very much informed, keep you up to date. We believe in alerting the citizens when necessary, but again, this is not something to panic about or to rush to the stores about. There's normal ways to protect yourself and be safe and be happy and go on about your business. And if things change, we'll certainly alert. And thank you for coming.